The brain that we looked at in our introduction had its tough outer covering called the dura mater, or tough mother, hard mother. It had been removed so that you could see the gyri and the sulci. And in that, I mentioned that the brain had smooth, thin coverings called the leptomeninges, which consist of the pia and the arachnoid that cover this bare gyrus of the cortex, as well as a outer tough covering, which I'm going to introduce you to now. And the dura mater is very, very tough. I cannot pull it apart. And it anchors the brain within the different regions of the cranium or skull. So it keeps the brain from shifting right to left by having a central partition called the falx attached to the base of the skull. And it also has an area called the tentorium, which you see here, which separates the occipital lobe above it, where my fingers are, from the cerebellum, which would be sitting in this region here. So the brainstem is in its own compartment, as well as the hemispheres in theirs, and there is no right to left shift. Because the brain is in the skull, which cannot expand, any kind of additional space-occupying structures, such as cerebral spinal fluid or blood, will cause the brain to be distorted because the dura mater cannot accommodate. They're in a fixed enclosed box. So let's look at this dura mater. The surface of the dura mater, the lateral surface, has on it an artery. These are branches that you can see here, still with some blood in them, of the middle meningeal artery. The middle meningeal artery, along with the trigeminal nerve, supply the dura. That means the dura is exquisitely sensitive. Then there is what we call the subdural space. So if I reflect back the dura, I can see that coming over to the surface of the dura are large veins, and they are emptying into a sinus, a fold in the dura, the superior sagittal sinus, where most of the superficial blood from the brain is draining. I showed you the tentorium on this loose piece of dura and said that the brainstem went through it. So now what I want to do is let you peer down and see the tentorium in place. So if I lift up the brain and pull back on the cerebellum, you can see the tentorium, and there is a notch in it, the tentorial notch. Through that goes the brainstem. So this tentorium separates, but is also a barrier to expansion. Anything above the tentorium, which is everything in either hemisphere, gets pushed down through that small notch that I just showed you. So that part of the dura is really important. And both epidural and subdural hemorrhages can push the brain down through this tentorial notch. Enough about the dura. Right here in the midline, the meninges have these little projections from the arachnoid. Remember, the outer layer is the arachnoid. These arachnoid projections, or villi as they are called, actually project into the main sinus that runs down the middle of the dura, the superior sagittal sinus. And these arachnoid granulations we'll talk about when we talk about the circulation of cerebrospinal fluid.